Welcome to Pharmahutandhealth. In this video we will briefly discuss about abnormal bone growth. Abnormal bone growth can be a serious condition that affects people of all ages. In this video, we'll discuss the causes, symptoms, and medications used to treat abnormal bone growth. Abnormal bone growth can occur as a result of a variety of factors, including genetic mutations, hormonal imbalances, and metabolic disorders. It can also be caused by injury or trauma to the affected bone. The symptoms of abnormal bone growth can vary depending on the location and severity of the growth. Common symptoms include pain, swelling, stiffness, and reduced range of motion. If your doctor suspects that you have abnormal bone growth, they may recommend a bone biopsy to confirm the diagnosis. This involves removing a small sample of bone tissue for laboratory analysis. Treatment for abnormal bone growth may include medications to reduce inflammation and pain. Over-the-counter pain relievers such as ibuprofen and acetaminophen can be effective in treating mild to moderate pain. For more severe pain, your doctor may prescribe stronger pain medications. In some cases, radiation therapy may be used to shrink the abnormal bone growth. This involves using high-energy radiation to destroy the abnormal cells. Surgery may also be an option for removing the abnormal bone growth. This is often the preferred treatment for larger or more complex growths. Thank you for watching, and we hope this video has been helpful in understanding the causes, symptoms, and treatment options for abnormal bone growth. If you suspect that you may have abnormal bone growth, be sure to talk to your doctor about the best treatment options for you. Don't forget to subscribe to our channel and hit the bell icon for more videos like this one.